Well, welcome to this talk. It's Sunday, the 26th of December. It's Boxing Day. Hope you had a great Christmas. Hope you're still having a great Christmas. Just a very brief update today, but there's some really important things I wanted to get across. Now, this is the first one here. The gap between getting first symptoms and getting hospitalised with Omicron in the UK is down to 10 days. So Omicron has got a shorter incubation period compared to Delta. And people that are being hospitalised, the small amount of people that are being hospitalised in the UK with Omicron are being hospitalised more quickly than they were with Delta. It's almost as if the whole thing is like compressed a bit. So it's really quite encouraging news, because we had been waiting for 2 or 3 weeks for people to get ill. Now it looks like we only have to wait for 10 days. And by and large, the whole point is that so far, most of us are not. Now, let's just a little detail on that. This is from Dr. Jenny Harries, Chief Executive, UK Health Security Agency. Now, the reason we were a bit confused on this is last week, Sajid Javid said the typical lag was 17 days. Sajid Javid, of course, is the Secretary of Health. And of course, this 10-day lag, we would imagine, is going to be the same anywhere in the world, whether you're in the States or Namibia or the UK or Canada or Australia. Probably doesn't make any difference because it's the same virus. So it's largely the same amount of days I would expect. So Sajid Javid had said 17 days. But it appears that Dr. Jenny Harries, the Chief Executive of the Health Security Agency, had told him that. Now, again, I'm stressed to point out I'm not making political points here, because Sajid Javid just told what his doctors told him. So it's a bit surprising that what seems to have happened is that Dr. Harries has gone off pre-Omicron data and was talking about Delta data. So to say she was out of date is probably about the kindest thing we could say there, and we'll leave it at that. But it is surprising that the Chief Executive of the UK Health Security Agency would give out-of-date data, as appears to have happened, to the Secretary of State for Health, who's making decisions about the whole country. I'll leave you to work that one out for yourself, but it does seem a bit surprising. Anyway, that's what seems to have happened, because the Office for National Statistics data, the average is 9 to 10 days. So it's a shorter time. So from when someone first gets symptoms, if they are going to be hospitalised, typically 9 to 10 days average. Now, Jenny Harries had said probably the most significant threat we'd seen since the start of the pandemic. Well, this may or may not be the case. It's starting to look like it's not the case. But the point is, if people can't be sure about the data that's been given out by these very, very senior people, then who's going to believe too much about what they say really is the issue? There's a real credibility issue here. Something needs to be done about this, but that's not for me to say. We do know, and we've looked at quite a lot of data on this, that 50 to 70% less likely to be hospitalised with Omicron compared to previous variants. So many less people are being hospitalised with Omicron. Now, what I want to do now is show some orientation that illustrates this, and a bit of orientation generally. So let's just go on to that now. So here we see these are newly confirmed cases. Now, interesting points here. What is happening in Japan? Very, very low rates. Now, we know there's low rates of testing in Japan, but there just doesn't seem to be anything going on there at all. Australia, well, we know the cases are increasing sharply, and we know that we don't know that Australia, it looked like the other day that Australia was taking a bit of a herd immunity, community immunity policy there, which would kind of make sense because they are quite highly vaccinated now, and they've realised they can't go on with their stringent measures forever. Now, I know that created some political problems from people in Australia who know much more about that than me. But that's, anyway, what we can say for sure is that the cases are increasing in Australia and will carry on doing so really quite dramatically, I would think. At the moment, mostly in Victoria, New South Wales area, but it will spread around the whole country. Canada, likewise, Omicron increasing. This is the Omicron surge starting now in the United States. Make no mistake, the United States, it will be increasing really, really dramatically. Already it's being grossly underreported in the States. Was it 3-4 days ago there was 70-75% of cases in the United States were Omicron already? So now it's going to be even higher than that because the doubling times are 2 to 3 days. This is just taking over immensely quickly. Ireland, again, Omicron surge. United Kingdom, Well, yeah, for sure. Denmark even further ahead in terms of new cases. So this is look at just how steep these lines are, just incredible. This is how Omicron takes over. Now, these are way out of date. Now, these are all these graphics, of course, are from Our World in Data, unbelievably brilliant site. Check it out for yourself. But they are out of date. So Australia does seem to be 80% Omicron. Now, that seems to be about right. United Kingdom, well, it's more 85% now. The United States, it's the same. So this is out of date. Japan, we don't know. Denmark, we believe it's much higher as well. Ireland, we believe it's much higher as well. And Canada, I believe it's much higher as well. So out of date, but it is starting to show now, even on the Our World in Data, as Omicron well and truly takes over. Now, a number of patients in hospital. Now, this is interesting and mostly reassuring. Now, Canada going up slightly. Ireland has actually come down. Denmark levelled off, despite the very high levels of cases in Denmark. United Kingdom, we are seeing a bit of an increase. This is partly Omicron, it's partly Delta, but we are seeing it. The United States, this increase at the moment is unclear what it is, because Omicron has only officially been recognised in the United States for the past week or so now, but we do believe it's been there for longer, so a bit harder to say about the United States, but we do know that the cases are going up. Now, my concern with the United States is that there are many more people unvaccinated, not vaccinated at all, in the United States. And the provisional data we've got, and it is only provisional data, that shows that people who haven't had the infection and people who are not vaccinated are only 11% less likely to go to hospital with Omicron compared to Delta. So it could well be that there's these large amount of people in the United States who are really quite prone to Omicron infection, because the intrinsic pathogenicity only appears to be 11% less. The reason we're doing so well, as we'll see in further slides, is we've got so much immunity in the UK and other places. Now, that's why we're doing so well, rather than it being intrinsically less pathogenic. So I am concerned that there's going to be greatly increased hospitalisations in the United States. Of course, the United States already has surpassed 800,000 deaths. It's just a terrible situation. And I am concerned that is going to go up in the States because of the low vaccination rates on some segments of the population. So that's my big concern at the moment. So I'm much more concerned for the United States right now than I am for the UK. But there we are. That's the hospital patients at the moment. Now, this is from the Office for National Statistics. Infections increased, of course. I think we know that. Infections have increased. Hospital admissions remain similar. This is just data from a couple of days ago. Deaths have actually gone down a little bit in the UK. Over 4 in 10 adults had 3 vaccine doses, and of course many more have had first and second doses. Over 9 in 10 adults had antibodies. 95% have got antibodies at the moment. So really we can say about 98% of the population of the UK have been exposed to SARS coronavirus 2 in one way or another. And this is a measure of social distance, which is similar, about their unit of 40. So there we go. I mean, that really summarises things quite well. And remember, the delay is now only around about 9 to 10 days. So we're not seeing dramatic increases in hospitalisations in the UK, which is good. Now, this is the Health and Human Services data from the United States. So inpatient beds, 71.85% occupancy. Of those, of the total beds, 9.63% occupied by COVID-19 patients. So still fairly high in the United States, but of course a lot of this is Delta hangover. But as we've said, Omicron, perhaps 11% less pathogenicity, so people in the United States with no vaccine doses at all are at risk. What is less clear in the States is how many people have had natural infection, because there has been a lot of natural infection spread around the States. But for those people who are completely unvaccinated and who have had no natural infection, only 11% reduced chance of going to hospital with Omicron. So really worth thinking about if you know people in the United States who aren't vaccinated at all. Well worth thinking about that mere 11% reduction in hospitalisation. This is ICU beds, so 75% occupancy, which is probably about right. I mean, when I worked on intensive care, that was kind of what we ran at most of the time, because they're very expensive beds to maintain. So you don't want to be maintaining a lot more than you've got. So 50, 60, 70% occupancy is not out of the way. It starts getting pretty stressful when you get above 90, but this isn't out of the way. But quite a high proportion of those in the States occupied by COVID-19 patients, 21.28%. Now, this is the latest figure from the UK. Hospitalisations with confirmed Omicron. In the UK, 366. Deaths so far, 29. I'll have more to say about that in a minute. It's fairly reassuring. Now, last week, Chris Whitty kind of gave us all a bit of a fright, the Chief Medical Officer, by saying Omicron is as well as Delta. And at the time I thought, well, I don't know, I suspect it's just a transition stage. So let's see what the data is telling us now. Now, this is the latest data. I'll give you the links, of course, to all this. Now, obviously what we see here is London. These bars are daily cases. So here it was all Delta. And then we started getting Omicron. Well, not that long ago, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 20, only 21 days of data there. So we are still in relatively early days. But the point I'm making is this was all Delta, and this is Omicron. Now, it looks to me like the green bars are getting smaller. The green bars are getting smaller. And there's no question there that green bar is smaller. That one's smaller there because it's incomplete, but that one's a bit smaller than that one, and that one's a bit smaller than that one. And in other words, what this means is, and this is the crucial point, is that Omicron is displacing Delta. And that is really good news. It is displacing it. So that is the data from London, which of course is ahead. So as we see there, 93.4% Omicron in London at the moment. But just to give another area, just to make sure, Southeast, for example. Now, and again, the key thing is the size of the size of the green bars here. The green bars are getting smaller. No question about it, as the Omicron gets bigger. So the Omicron is displacing the Delta. And that's what we wanted to see, because the Omicron features are less severe and hospitalisations are less. Now, the other data we've been keeping an eye on, South Africa, just over 9,000 patients in hospital in South Africa, so it's not scooting up. Not many in ICU, not many in high care. And remember, this is for a population of 60 million. So remember that kind of context. And people currently needing oxygen, gone up slightly, gone up by a couple of hundred. For the population of 60 million, now 1,409 people who diagnosed with Omicron, because it's all Omicron in South Africa now, who are in hospital requiring oxygen. Not all of these requiring oxygen for COVID, because many are incidental. About 50% of these, we believe, are incidental admissions. So remarkably good news, remarkably good news. Slight provisos here. This is London. These are people in hospital in London. So we can see this is going up over the last few days. Each block here is a day. So that's going up a bit in London. And of course, London is ahead. So the rest of the UK will be following. So are we going to see some increase in hospitalisations in the UK as a result of Omicron because it's so massively everywhere? Yes, some. Is it going to be small and modest? We hope so. To put numbers on that, 2,260 people with COVID in hospital in London at the moment. But most of these, we believe, are not Omicron. Most of these are not Omicron. So the REACT study, round 16. The REACT study, remember, is looking at the amount of immunity and things in the population and the amount of infection. It's a collaboration between Imperial College London and Ipse Moray. Round 16 detected 11 cases of Omicron up to and including the 11th of December. This is the antigen branch of the survey. So basically we can say that Omicron began on the 11th of December because then they'd only detect 11. Now, there were more in the pipeline. Obviously, there was more than that. But mid-December, early mid-December is basically when it started. And, of course, we won't know the next one for, I think, is it every month that comes out? I can't remember now. Anyway, these are all the references for all the slides we looked at. So everything we say there is hopefully evidence-based. Now, I'm going to keep this is for the 24th of December. I'm going to just keep an eye on this. So total new cases per day, 122,000. Percentage of cases that are Omicron, 71% to 93%, depending on the part of the country. Patients in hospital as of the 24th, 8,240 patients in hospital. Patients with Omicron in hospital, 366. So there we go. I haven't bothered working that out as a percentage, but 366 patients with Omicron, diagnosed with Omicron in hospital, a total of 8,240 patients with COVID in hospital altogether in the UK. Very small percentage is Omicron so far, and we're looking at a 9 to 10 day gap. We're about 21, 22 days in now. So yes, we are going to see more increase in hospitalisations because of the very rapid increase in cases, but I believe it's still going to be small. Remember, the vast majority of cases presenting as a common cold now. COVID deaths, 137 on the day, 887 in the last 7 days, and Omicron deaths have started to feature in the last 7 days, and they were 29. So of the 887 deaths in the last 7 days, 29 were Omicron. And again, I haven't worked it out as a percentage, but we can see it's a very small percentage, and I'm optimistic that deaths aren't going to increase too rapidly. And it just seems a pity that some of these officials may have tried to overstate the situation. Let's hope that's not the case. It could just be incompetence, using out-of-date data, but unless there's a third or fourth alternative you can think of. London, Omicron now 1 in 10, according to the latest updates from the interim updates from the Office of National Statistics. It was 1 in 20 a few days ago. Now it's 1 in 10. So 10% of the entire population of London is infected with Omicron now. We are at the mercy of this virus. We don't really have too much time left to get booster doses in. There's still time to get some top up your immunity, though. I'm taking a bit more vitamin D because I'm being expected to be exposed any day. In fact, I've probably got a little bit of a cold now. I tested about 3 days ago and it was negative, so I'll probably test again in the next couple of days. Keep an eye on me. Now, one last thing. Now, this is from BT in Namibia. Now, if your geography is about as good as mine, Namibia is basically, it's just to the side of Botswana, isn't it? So you've got like South Africa, then Botswana, then Namibia on the west coast of Africa, right? Quite a lot of desert in Namibia, I believe. But anyway, let me read you this from BT. This week in Namibia, we had 64 people in the whole country in hospital with COVID. And we're also more than 90% Omicron since November. So because it's just next door to Botswana, there's been lots of Omicron there already. So, in fact, did Omicron arise in Namibia and then go to Botswana next door? We don't really know. It was that part of the world. But if we assume it started in Botswana, then it went south to South Africa, it went west to Namibia. And it's that part of the world where it almost certainly started. So this week in Namibia, we had 64 people in the whole country in hospital with COVID-19, despite having 9% Omicron since November. Our total population size is just 2.7 million. Everyone I know, including myself and both my parents, has had Omicron in the last few weeks. So basically it's ripped through the country. Despite very low vaccination rates, our population is poorly vaccinated, 25% vaccinated. But the death and hospitalisations have increased, but not like during the Delta wave. So they've increased, but only to 64. So they have increased a bit, but not very much. And this is with low vaccination status. Now, I think we can assume that in Namibia, like South Africa, there's been a lot of natural immunity. from people that have been exposed to previous waves, such as the wild type, the alpha type, the beta type, the delta type that went through that part of the world. So younger demographic, of course, in Africa, but so far quite a relief. The other big proviso is that so far, in the UK at least, the proportion of the people in the population that have been mostly affected so far have been in the younger age group. So how this is going to affect older people when older people are infected, as they're going to be in the next week or so, less sure about, but they are more vaccinated. They're more vaccinated. The other thing was pretty concerning, I don't know if I mentioned it there, but people of Afro-Caribbean extraction in London are getting more cases and seem to be getting sicker as well. And of course, that's the very part of the population that are most likely to be deficient in vitamin D. So do have a discussion with your friends about that. Make a few phone calls, see what they think. I know I've increased mine because I believe the evidence is there. And that's just a brief update, and thank you for watching.